Yeah. So welcome to day 2, everybody. We're so thrilled to have you back. As Dr. Laura mentioned, just a couple housekeeping tips. So we will be recording this masterclass and we will be sending it out after. And if you have any questions, just feel free to utilize the chat or the Q&A box. We will be answering questions as they come, throughout this masterclass. We do want to make this interactive so that you guys can benefit from it. And then we'll also keep time at the end for it.
Okay, great. And as well, I just need to go over our medical disclaimer. These sessions are really for educational purposes only. And so before you start anything new, changing up diet, supplements, anything in your lifestyle, always check with your healthcare provider first to make sure that this education and this information is appropriate for you.
And before we dive in today, we really wanted to share a patient story or case with you guys to really bring some context into what we're talking about today and to kind of provide a framework. So we're going to call her Jane. It's not her real name, but Jane came into our office about 2.5 years ago. And she was really struggling with her symptoms of PCOS. So what she was experiencing was irregular menstruations. I think at the time she was probably having about 3 to 4 menstrual cycles a year. And then what was really bothering her and what kind of drove her to come into the office was acne that she was experiencing, and then weight gain, and really just feeling so frustrated that she wasn't able to lose the weight that she had gained. And in her words, she said, I've tried every diet under the sun. And to me, what I really wanted to work on her with is that it's really when you get into those restrictive diets and you kind of try everything, fueling yourself and meal times can become very, very stressful and really impact your relationship. And in her case, her relationship with food and fueling herself and her body. So we really wanted to work hard at kind of dispelling those diet myths that are out there, and then really bringing a plan together that was sustainable for her. So feel free to chime in the chat if you kind of relate to any of Jane's story, and then just keep her in mind as we kind of progress through the content that we're sharing today.
Yeah, happy to hear from some of you. I'm sure a lot of you can relate to that. I've tried everything. That's what we hear a lot in our practice. And I'm going to just give now a quick recap from yesterday, as I know some of you might not have been able to join us. Yesterday, we talked about the 4 subtypes of PCOS. So PCOS being a syndrome is a collection of symptoms. The most common being that insulin resistance PCOS. So when you have those big sugar cravings, if you feel shaky or nervous if you don't eat. Inflammatory, where there's underlying oxidative stress and inflammation. So you can probably feel pretty achy. Post-pill, which is more of that temporary state, which can happen after coming off birth control and your period doesn't resume, as well as adrenal type PCOS, which has to do with cortisol and the interplay of cortisol, our stress hormones, and how that can affect our cycle, and also DHEA, which is an androgen, which is commonly high in PCOS. And as we said, you may not fit into one perfect box. Often there's a combination, and this can help us determine how best to treat you based on how you are presenting with your specific PCOS symptoms.
Yeah, exactly as Dr. Laura said, like there definitely is overlap among these, but some of them have slight nuanced changes that can just help us create the best kind of treatment plan that's targeted to your individual case. So this is what we will be covering today. No nonsense diet and nutrition for PCOS. So we're really, really excited about this because we really want to bust some of the diet and nutrition myths that are out there. And then we want to answer the question, okay, great, those don't work, but now what do I do? So that's what we're going to dive into today.
Great. All right. So what dietary advice have you heard? And so Dr. Keir Taylor and I kind of wanted to go through the main things that we see a lot of people asking us questions about, or people have tried, or in the process of trying and they're feeling totally frustrated. This is a short list, but again, we were picking kind of the most common things. If there's something else you've heard or you have questions about, feel free to type it in the chat and we can go over those as well, because I'd love to hear from you. But I want to start with these. And so an elimination diet, this is also sometimes referred to as a hypoallergenic diet. And this is one of the things that's, I guess, sort of a pet peeve of mine is that people go, well, I went to a naturopath and they just told me to cut out gluten and dairy. Well, why? I don't know. They just said it was bad for me, right? And, they kind of get this blanket statement, eliminate gluten and dairy, when we actually have no reason as to why, right? A gluten-free diet has not been shown to help your symptoms of PCOS. In fact, it's probably just going to make them worse because you're going to be totally frustrated and deprived. Certainly, there are cases with gluten sensitivity where we might want to consider removing it, but that is on a case-by-case basis. One thing that we do want to be mindful of is dairy, and we're going to talk about that more on the next slide, so keep that in mind. But these are meant to be short-term, where we eliminate and reintroduce, and we figure out, is that an issue for you, versus saying, oh, you have PCOS, you have to be gluten and dairy free. That's really not an evidence-based and individualized approach to your care. The next big one is keto, or the ketogenic diet, which was super popular for a while there. So a ketogenic diet is very low carbohydrates. So we're talking like less than 20 grams per day, whereas even like a lower carbohydrate diet would be more around 150 grams per day. So just to give you context of how low that is, it's like half a cup of blueberries. That's it. And everything else has to be some sort of fat source and actually quite moderate protein. So when we look at the research, it does work. Ketogenic diets do lead to weight loss. They do help with blood sugar and PCOS, but here's the caveat. They're not often sustainable. So yes, the study showed a benefit when, participants were getting their meals delivered and cooked for them. Then the 12 weeks are up and they go back in the real world. How are you going to survive? Who's eating half a cup of blueberries a day and no other fruits? I'm sorry, but that is very difficult to maintain and also have a social life and think about, all the stress around building your meals and doing food prep for the week. The other thing with the keto diet is often in these studies, it's also a low calorie diet, right? They're not just giving them, a ketogenic diet, they're also controlling for their caloric intake. And we know that if we just, reduce calories, people are going to lose weight, whether that's a keto, whether that's a low fat diet, whether that's like a vegan diet, doesn't really matter what they do. If you reduce calories, they will lose weight. And certainly there's healthier ways to lose weight when we look at that breakdown of macros. But that's my problem with keto, is the sustainability and the fact that often in these studies, they're also cutting calories. Now, the last thing is intermittent fasting, which we spoke about a little bit yesterday. And I'm not a big fan of this for a few reasons. Mostly because, a lot of the studies are in men, and women are not small men. We are a totally different metabolic machinery. And we can see with really intense intermittent fasting, a lot of women won't ovulate because it's a stress on the body. And if the body thinks you're not getting adequate calories, you're in the starvation mode, it doesn't know where your next meal is coming from. It doesn't want you making a baby, and you will stop ovulating, which is already an issue for people with PCOS. So we're just kind of putting, gas on the fire, right? And that's not what we want. So with intermittent fasting, there is some benefit to it. And this is something that I always say to patients. So let's say you're doing a fast from 12 to 8. So you only eat between 12 p.m. and 8 p.m. Okay, that works because after 8 p.m., you're not reaching for salad. You're not reaching for that green smoothie. You're reaching for potato chips and popcorn and chocolate. So if we cut out eating at 8 p.m., you're having less of those processed foods. You're probably eating less calories. You're going to feel better. You're going to sleep better because you're not eating right before bedtime, and you're having less sugar and processed carbs. So I'm a fan of intermittent fasting if it gets you to actually sit down and eat a real meal, but I don't want it to the point where you're having one meal a day and you're starving yourself for the rest of the day, because that's only going to further impede your ovulation. So these are things that we often see patients on, and we typically try to work, getting them off of it and finding a more sustainable approach to their diet.
Yeah, the point about the intermittent fasting is so interesting too, because like Dr. Laura, you were saying about how it can impede ovulation, because we have data that shows that the hormones that are coming from the hypothalamus into the pituitary to kind of trigger the LH pulse to get you to ovulate is actually it's always scanning the environment for how safe it is in a caloric restriction, through even just if it's a certain time of day and you're not getting enough calories, it's happening every 90 minutes. So every like hour and a half, if you're going a prolonged period of time without eating, it can be detrimental. Now, that being said, I mean, are huge fans of individualized medicine, right? So of course, there's going to be like ways to kind of tweak all of these things that may actually benefit you. So with something like fasting, I think Dr. Laura would agree with me that, you know, we do kind of encourage like at least a 12-hour fast between, you know, like dinner to breakfast the next day to make sure, and having that break can really help to support insulin levels and glucose levels. And you might feel good if you kind of push that out to maybe 14 hours, but you have to really tune into your body and listen and think, like, when I get to my next meal, am I starving? And then like, I just want to eat everything in sight, or do I feel like I'm kind of balanced from like a blood sugar perspective? So it is a bit introspective to kind of ask yourself some of those questions about how do I feel, you know, not eating for this period of time? How do I feel at my next meal? How is my energy through the day? Even going back to our subtypes of PCOS yesterday, right? In terms of like, if you're falling under that adrenal PCOS picture where you have tons of stress in your life and you're very stressed through the day, that going long periods of time without eating and throwing coffee in there instead is just adding more stress to the body, right? So things like that. And even going back to Jane, she I know that she specifically with the intermittent fasting had tried that. She actually enjoyed it for probably like a week or two, and then found that it was really a challenge. Like later in the day, she was having really low energy levels and feeling really exhausted. And then the keto diet as well. Like I've seen that with patients where exactly like Dr. Laura said, like it can be effective in the short term in terms of helping with weight loss immediately, but it's very, very hard to sustain. And then coming back to the issue with then the relationship that you have with food, you then begin to fear carbohydrates, right? Like you fear those foods, which just it's not great long term, right? Okay, so now let's chat about some nutrition for PCOS. So again, starting with restrictive diets do not work long term. So I think we've kind of talked about that already. This was just a really big point that we really were hoping to kind of convey today for you guys, is that there's no need to engage in something that's really, really restrictive. Because even though you might see benefits in the short term, like it's just not sustainable, right? So going back to the ketogenic diet, like having absolutely hardly any carbohydrates for the rest of your life probably isn't manageable to sustain. And then even with the intermittent fasting, like again, there might be some wiggle room in there in terms of like what you feel best doing. But it's just anything that's too restrictive is just not sustainable. And then the big question is dairy. We hear this all the time. Like Dr. Laura said just now about the gluten in the dairy, that so many people come into our office and is like, can I have dairy? Like I've heard it's awful and I'm not, like I have to cut it out. And actually here it says the better question is, does it impact your acne? Because we don't have any data to support that it has any negative implications in PCOS, except we do see that acne is associated with, dairy is associated with acne. So yeah, dairy is associated with acne. And so we do see that there is an association there in terms of it increasing the number of lesions and the number of inflammatory lesions. And again, this is going to come back for you to know whether whether dairy impacts you or not. This is going to come back to that individualized approach. So this would be a case where a kind of little elimination diet or elimination experiment, we could call it, would probably be beneficial for you. So you could try eliminating the dairy for about 4 weeks. And then adding it back. And basically, when you take it out, if you notice a decrease in the number of acne lesions and like the number of inflammatory or cystic lesions that you have, and then if you add it back and you notice a flare in the acne, then it probably is impacting you. Now, that being said, we do see in the literature too that there is kind of a dose response to dairy. So for some people, if they're keeping it like less than kind of 3 to 6 servings a week, it may be fine. So it's something that you have to kind of figure out a bit more for yourself, bringing in that kind of individualized approach to it.
Mm-hmm. And that kind of leads into, it's perfect segue into protein adequacy. And one of the reasons I'm not a fan of eliminating dairy unless someone is noticing a benefit is because dairy can be a really good source of protein. Half a cup of Greek yogurt, half a cup of cottage cheese, somewhere between 10 to 20 grams of protein, depending on the brand. And I feel like sometimes my entire day's work is just convincing women that they need to put more protein in their diet. And protein is very satiating, right? It fills you up and it keeps you full. And so if you have a meal that has adequate protein, you shouldn't be starving an hour later, right? If you eat lunch and you're starving an hour later, that meal failed you. It didn't do its purpose. So then it becomes a question of, well, how much protein do I need in a day and what does that look like, right? When we kind of look at studies for just minimal protein requirements, so for you to just eat, breathe, go throughout your day, it's about 0.8 grams per kilogram of body weight. And so what I like to do is think about, okay, we don't just want you minimum, we want you optimal. So we're looking at least 1 gram of protein for every kilogram of your body weight. So if you weigh 60 kilograms, you're getting at least 60 grams of protein per day. And people will say, well, I eat lots of protein. I have a boiled egg for breakfast. A boiled egg is 6 grams. 6. That's 10%. And if you're having that, and then maybe, a quick sandwich for lunch, maybe some hummus, and then dinner is like whatever, there's no way you're meeting your protein needs at that point. And so, that's when I work with patients, as is Dr. Kira, looking at, okay, what are our macronutrients, so our protein, carbs, and fats? How many do we need per day? And then taking those macro requirements and actually breaking down what each meal is going to look like so that you have a better idea of knowing, okay, you know what? Half a chicken breast is around 20 grams. A serving of salmon, a portion of salmon, somewhere between 20 to 30 grams. So I need to be having at least 20 grams of protein at every meal, plus a protein-rich snack to meet my requirements. And that's where we can come in and really support you in making sure you're having protein adequacy. And I find when people bump up their protein, they're like, I'm not starving all the time anymore. And I'm like, yeah, we just need to give you some more protein. And maybe you do need that scoop of Greek yogurt with your berries in your smoothie every morning to help you get there. The other right?
Sorry, I was just I don't mean to interrupt you, but I literally just had a patient this morning who, this is always like where I start too, in terms of, okay, let's just see what protein we can add. Like, what are you eating in each meal through the day and how, and like neither Dr. Laura and I are into like calorie counting or anything like that. Again, that's going into that kind of restrictive, more like control in the diet mentality, but just having awareness over what sources of protein you're having and kind of, am I reaching that amount? And so this is our second appointment. In our first appointment, we were talking about, she did have a protein powder, but then she went home and realized that there was like 10 grams of protein in it. And she was like, I just didn't realize like how little protein I was having. So then she is using a protein powder, which we do think can be a great way to add extra protein. Like, yeah, like especially in the morning, breakfast is usually, I find, like the challenging meal to get enough protein in, because even like as Dr. Laura said, like having 1 egg, you're still only having like 6 grams of protein. So protein powder can be great. And anyway, I just wanted to share that she was like, it's made such a difference, like just by being cognizant of how much protein and making sure I'm having it in each meal, just in terms of that satiety through the day. And protein is like balancing for blood sugar and insulin levels too. So it's just a good place to start. And then as Dr. Laura said, like good sources are, like eggs, protein powder, chicken, turkey, fish, things like that.
Yeah. And yeah, thank you, Alex, for chiming in. I had no idea I needed that much protein. Yeah, most people are shocked, or people don't realize that they're like, oh, wow, an egg is only that much. I'm like, yeah, we need you eating 2 eggs and, a piece of whole grain toast, right? Like you can't just have 1 egg and then, think that that's going to fill you up for the whole morning. It's certainly not enough.
Yeah.
And I just had a question here. Alex, I'll type in the chat for everyone, just so that we'll go through the grams per kilogram. Go ahead, Kira.
Oh, no, you were answering that one?
Yeah, I'll type it in the chat after I'll finish up the slide and then I'll type that in the chat for you for sure. And then the last thing here, which I always say wrong, is ages. I'm not exactly sure, but what it stands for is advanced glycation end products, which is basically a carcinogen, which is commonly found in a lot of our foods. And AGs, these glycated end products, have been shown to worsen insulin resistance, especially in PCOS. So this can, instead of, we're always trying to improve our metabolic parameters and our blood sugar control, AGs, we can see a worsening of insulin resistance and further oxidative stress in the body. And that oxidative stress can lead to symptoms when we talk about that kind of like inflammatory PCOS, of feeling achy, just kind of exhausted, not feeling like yourself. So we're always trying to decrease that inflammation and oxidative stress. And AGs, these advanced glycation end products, are most commonly found in things like baked goods. And so croissants, packaged cookies, packaged crackers, meats cooked at a high temperature. So anything where there's like a lot of high temperature cooking. So you can think of going into your grocery store and I always think of like the big chocolate chip muffins, right?
Yeah.
Or those packaged crackers, or the 6-pack of croissants. So really any kind of baked goods. And so it's not even just about the muffin, which is really a cupcake. It's the fact that these AGs also have another detrimental effect on our insulin and our insulin control. And when we have that insulin resistance, that drives our testosterone, which further drives our acne. And so we really try to minimize those processed foods for multiple reasons. And that's why we want to focus on more of a whole foods diet. Like you can see here in our slide, the salad is all ingredients that your grandmother would recognize, right? It's all whole, real foods. So can we get more fruits and vegetables? Can we get lean protein? Here they have, some chickpeas in the salad. Can we get those complex carbohydrates like the sweet potato? Can we get some healthy fats like the avocado? So we try to focus on more of a whole foods diet while limiting some of those processed foods, because these AGs can further be detrimental for PCOS in some of the studies that have been performed on them.
Yeah, and this is exactly kind of what we worked on with Jane too, is just really focusing on the protein aspect of each meal and then focusing on bringing in those whole foods, and really trying to just crowd out basically any of the like packaged processed foods with it. And I think this is a great time too to kind of mention that yesterday we talked a little bit about like mindset and how we're trying to, really want to cultivate that like supportive, encouraging, inspiring mindset. And when it comes to nutrition, I always like to try and think about it as how can we focus on, instead of like what can't we eat or like what diet do I need to follow, it's more like how can I best nourish myself, right? How can I best nourish my cells by feeding them, the great sources of protein and complex carbohydrates and healthy fats, and things like that. And yes, the salad, I mean, it looks beautiful, right? Like the presentation is great. So, and all the colors, but it's really about how can I nourish myself? And then in PCOS, we're really just thinking about that blood sugar balance and managing insulin, and reducing inflammation. So all of these kinds of points that we made are just geared towards that. Okay, so here we're going to chat about some superfoods for PCOS. So, and when we say superfoods, these aren't crazy exotic foods that you can't find. These are all ones that are available probably at your local grocery store, but we just call them superfoods because we have data to support their benefit in some of the symptoms and in PCOS. So to start with here, we have phytoestrogens like flax and soy. So phytoestrogens are nutrients that actually bind weakly to our estrogen receptors, and they can have a protective kind of hormone effect in our body in terms of helping to protect us from any exogenous or like endocrine disrupting estrogens that are affected in our environment. So flax and soy both have that benefit. But also in terms of PCOS specifically, flax seeds, we have data to support that they do help with insulin resistance and inflammatory markers. So like CRP, things like that, they can actually benefit them. Flax has tons of benefits in terms of it has those phytoestrogen benefits. It's also great for fiber. And something that I hear a lot, and Dr. Laura, will see if you agree with this opinion of mine, but in terms of seed cycling, right? Hearing about flax seeds in seed cycling. So if you guys haven't heard of seed cycling, it's where you kind of cycle the seeds that you're having. So in the follicular phase, it would be flax seeds and pumpkin seeds. And then in the luteal phase, it would be sunflower seeds and sesame seeds. Now, there is no data to support that doing that kind of like seed cycling is going to regulate your ovulation or regulate your menstrual cycle. I think that adding any of those kind of seeds, healthy fats, everything that's in there is really beneficial. And I think it can be a good way to kind of like connect you with your cycle. But when we talk about something like flax seeds here, we're really talking about like continuous use of flax seeds. So doing those like 2 tablespoons of ground flax seeds a day. So adding them to like a smoothie or like an oatmeal bowl or a Greek yogurt bowl or whatever you're kind of having it with. But we do see that it can kind of benefit those parameters. Do you agree, Dr. Laura?
Yeah. No, I agree. And also then people get stressed out about seed cycling because they forget which seeds they're supposed to have when. And I just think it's incorporating more healthy fats is where we see the benefit.
Exactly. Yeah. So here we see flax as a real superfood for PCOS. And then same with soy. So soy is also a phytoestrogen, but then we also see that adding soy protein into the diet can help to reduce BMI, fasting blood sugar and insulin, and improve triglyceride levels. Plus, soy protein is a great source of protein. So going back to the conversation we just had about protein adequacy, it can be a great food to add in to get like another source of protein as well.
Mm-hmm. You're making me hungry for lunch. I just remember I have a tempeh sandwich. So I love tempeh fermented soy. It's really tasty.
Yeah, tempeh is actually my favorite source of soy too. I really like it.
Yeah, now that I'm thinking about food. So the next one as a superfood is spearmint tea, and this is specifically spearmint. So I personally love peppermint tea, but the data is on the spearmint tea, which is not too hard to find. And I know you can also buy it loosely from a lot of different tea providers. And there's been some research to say that having 2 cups a day can be really beneficial for acne and seems to have an anti-androgenic effect. So again, androgens are more of those male hormones like testosterone. And so simply having 2 cups of spearmint tea per day, what they found is that the participants, their skin was improved, and also there was less hirsutism, which is that kind of, chin hair or hair on the chest, often what I call the unwanted hair, where you don't want to have to be, some of my patients with PCOS have to, shave their chin every day. And that's just because their androgen levels are so high. And by adding in the spearmint tea, again, those 2 cups, so you do have to drink kind of like a full tea thermos of it, does seem to help with acne and hirsutism by reducing those androgens. So something that's pretty easy, nice and tasty in the winter time. And so hopefully if you like spearmint tea, something that you can, consider adding into your diet if that's going to be right for you.
Yeah, that's such a great one to add in. And traditional medicinals has a really good, just like loose leaf, like tea bags that are pretty easy to find at most grocery stores. And I always say to like keep it covered to make sure that you're getting kind of all of the like benefits stuck in there. Okay, so the last one that we have here is apple cider vinegar. So I'm sure many of you have heard of apple cider vinegar. And we do have research to show that it can help to reduce the glucose spike and resulting insulin spike after eating meals. So I love to recommend this like a tablespoon or 2 in a little bit of water. Have it just before you have kind of like your main meals of the day. It also is a really great like digestive bitter. So it can just kind of help with how you digest your food and just kind of make the whole experience feel a little bit better. But that's another, it's so available at so many places. You can also put it in like salad dressings and things like that, but that's a great thing to just add into your meals as well.
Love it.
Yeah. Okay, so now we're moving on to exercise. The first question here is, what is the best form of exercise? And really, the best form of exercise is any exercise that you're actually going to do consistently. It's so important with exercise to find something that you enjoy and that doesn't feel like a chore to do it, because then it comes back to that idea of it being more sustainable and consistent. Because really with exercise, it's going to be the consistency of doing it that's going to get you the most benefit. And we do like to kind of break down like exercise in terms of movement and then like actually targeted exercise. So movement, you want to make sure that you're walking daily. I always love to recommend going for a walk to get the exposure to daylight first thing in the morning, especially with daylight savings time. It can be great to make sure that you're getting outside and kind of re-regulating your circadian rhythm to the new time. But in terms of focused exercise, which we definitely encourage, because exercise has such benefits in terms of it helping with insulin resistance and weight loss and metabolism and all of those kinds of things, and hormone balance overall, like it's just so important. So I want to ask you guys, I mean, jump in the chat if you want, but to kind of think about like what type of exercise do I really love to do? Like, is it something like Pilates or yoga? Or is it something more intense, like more high intensity or running or things like that? And what I've really seen through, especially this year, through the pandemic, is that a lot of people who really thrived in that class environment or only going to the gym, like they really struggle to get the exercise in. Yeah, Dr. Laura's nodding because I'm sure she had this experience too. And so it was just kind of about trying to think about things that you really enjoy doing, and then adding, and then trying to incorporate those in.
Mm-hmm. Yeah, no, I think that's so important, right? It's like, the best form is the one that you're going to do, right?
Yeah, consistently.
If you hate yoga, don't do, or some people are like, I hate exercise, I hate running. I'm like, then don't run, right? Like if you hate, I don't run, I cycle, right? So don't feel like exercise means running on the treadmill. We can find other ways of exercise that you enjoy. And we know that a lot of it comes down to just getting started. And that's where we want to set those SMART goals, right? Probably something you've heard before. So SMART being specific, measurable, attainable, relevant, and timely. Those are kind of the main things. So when you set a goal, the more we can make it a SMART goal, the more likely you're going to stick with it. So specific. So I'll give an example. I want it to be, I want to do more exercise, and specifically, I want to cycle more. Measurable. How am I going to measure that? How often do I get out on my bike? Is it something that's attainable? Yes, I like cycling. I live near a bike lane. I can actually do it. And maybe I'm going to say 3 times a week, right? Like think about, is this something I can commit to? Because often people come up with these really grandiose ideas, like I'm going to run a marathon. And I'm like, let's start with a 5K, right? We need to start and build those baby steps. Relevant. Is it something that's relevant to you and that matters? The R also sometimes stands for that realistic. So again, that realistic piece. And then timely, when are you going to do this, right? So maybe it's going to be for me, my commute. So right now I cycle to work, so I can fit it into my schedule, 30 minutes a day to and from my clinic, right? Maybe time-based, you'll do 30 minutes in the morning. Maybe mornings are really hectic because you have young kids and you have to do it over your lunch break. So thinking about how you're actually going to do this can make a huge difference between, wanting the exercise and doing the exercise.
Yeah, and that's why a lot of people, I think, the people will also ask, like, when is the best time of day to exercise? And again, the answer will be, again, whatever time you'll actually do the exercise.
Yeah.
We know that there are benefits to like doing it first thing in the morning because your cortisol levels are a little bit higher, and then or in the late afternoon is a great time to like build muscle and things like that. But really, it's just when you're going to do it. And if you are someone, like if you have kids, or you know that you have a lot of things that come up later in the day, often doing it first thing in the morning is the best time, because that's just when you'll get it done, and then you don't have to think about it for the rest of the day, and nothing's going to get in your way.
Yeah, get it out of the way.
Yeah.
Okay, and then we're going to talk a little bit here about so important components of exercise. So there's 2 kind of types that we want, and we do really want to have a combination. The first one is resistance training, and similar to me, trying to always get people to eat more protein. I'm always trying to get women to do more resistance training, which is also referred to as strength training. A lot of people are worried, but I don't want to get bulky, I don't want to get big. We're not. Again, women are not small men. It's not physically possible for us to bulk up that way. We are a different metabolic machinery. We need that resistance training though, because we know if we have more lean mass, so versus like fat mass, more of that lean mass, that muscle tissue, that's more metabolically active. And as we build that up, we'll have more of an afterburn after exercise, meaning we'll burn more calories at rest. We also know that strength training is important for building our muscles and helping keep us healthy long term, because our muscle mass declines when we age. And if that muscle mass goes down, then again, our kind of resting metabolic rate will decline. So we want to try and keep that muscle mass up. At the same time, we do want to support our cardiovascular system through aerobic exercise, so helping with blood flow. So this is where brisk walking, running, jogging. So I do really like that combination approach. So maybe you're doing, 30 minutes of strength training in the morning and then going out for a short walk at lunch, right? So seeing the benefits of both. A lot of people, there's a lot of studies that show one's better than the other. The reason the studies are mixed is probably because we need both of them. And so I really try to encourage you to do a mixed variety of exercise throughout the week.
Yeah, that's great. And then the other point that I just wanted to bring back to what we talked about yesterday with the different subtypes is that there can be some kind of nuances here in terms of what's going to benefit you best. And what comes to mind again is with that kind of adrenal picture, like if you are feeling really, really run down and highly stressed and kind of like you're running on empty, then we still, like, exercise is still important, but maybe we want to bring down the intensity a little bit. So maybe the intensity will be different. So with the resistance training, like maybe you're not lifting like really high, heavy weights and trying to do your like 1 rep max or whatever. I don't know. I'm not in the lingo of the CrossFit.
That's correct. Yeah.
Something around there. But so maybe instead you're doing some like Pilates or body weight exercises where you're still putting resistance, on the muscle. And then with the cardiovascular stuff, maybe you're going through a period where doing tons of running isn't great for you, but you want to do like brisk walking, get your heart rate up, and just making sure you're incorporating those things. So there is ways of incorporating that stuff, but making sure that the intensity is kind of matching like where you are from a health perspective. And I always think a good question to ask too is like, how do you feel after you exercise? So if you exercise and you feel like great and energized for the rest of the day, that's good. The intensity was probably good. If you feel like exhausted right after, you feel like you could take a nap, or an hour later you totally crash, then maybe the intensity was a little bit too much.
Yeah, that's perfect. I was literally going to add on like my litmus test for patients is, how do you feel? They're like, oh, I feel really great. They're like, no, I work out and then I'm just totally wiped. I'm like, all right, well then that's not serving your purpose.
Exactly. Okay, so to recap on everything that we covered today, we were covering all diet and exercise related to PCOS. So really going through thinking more about some of those kind of diets that are out there in terms of keto diets, intermittent fasting, and just bringing a bit of a caveat to those in terms of how they are affecting you and whether they are the most beneficial for you. And then thinking of some of those components that you can kind of bring in. So making sure you're getting enough protein with each meal, you're bringing in the whole foods and kind of avoiding and trying to crowd out the processed foods and packaged foods. And then adding in kind of those superfoods. So like the flax, soy, and spearmint tea and apple cider vinegar.
Perfect. And if you're wondering, how am I going to add those things? I've never used flaxseed before. I bought it at the grocery store. It's been sitting in my fridge for a year. It's okay. We have you covered. We're going to put some recipes in our hormone Facebook group. So make sure you jump over there, and that's where you can see the recording and the notes from today. And we'll be putting a couple sampler recipes that we love and we've tried, and we know that you will love them as well. And then the next day, our day 3 is going to be lab testing. We're going to talk about lab testing that you absolutely need, that you've probably never had done, and the next steps for your health journey. We're also going to be going over our 3-month PCOS program, which we're super excited about. We're just launching it here at Higher Health Center and going through all the benefits you can get from being part of our 3-month program that we will be offering exclusively to you. So make sure you join us tomorrow for the lab testing. Check out the Facebook group as well for our recipes. And then I do see some questions here in the chat. So hang out for a minute if you have any questions, and we'll go through those as well.
Oh yeah, here's one question from Alex R. Hello, Alex. Are there any issues with eating rice? Seems to be a lot of opinions on that. Any science backing? So I would say that there is no issue with eating rice in terms of it's not necessary to cut rice out completely. Again, with the rice, I mean, it can be like if you're having white rice, it can kind of spike in terms of that, like the glycemic index. It can be a little bit more spiking in terms of insulin and glucose. So that's kind of where you'd want to make sure that you are pairing the rice with like a good source of protein, some healthy fats, and then just making sure that the rice kind of isn't like the main thing of your meal, but you're just making sure that you're getting that like protein and the healthy fats with it as well. And then of course there's like brown rice and whole grain rice and all that kind of stuff. But again, there's an argument out there for every type of food, right? So it's like, oh, the white, yeah, like there's arsenic in rice, or like the brown rice is like, there's issues with all of it. So really it's how does your body respond to it? And then just making sure that you are incorporating those good sources of protein and healthy fats.
Yeah, and I will say the issue with rice, kind of like the issue with a lot of carbs, is that we tend to overestimate how much protein we eat and underestimate our carbohydrates, in the sense that a serving of rice is half a cup cooked. So if you've ever actually measured out what a half a cup of rice looks like on your plate, it's pretty small. So 2 servings, like having 2 pieces of toast, is a cup. And a lot of times if you're having a meal, you might be eating like 3 or 4 servings of rice without even realizing. So that's where kind of understanding what a portion looks like. Do I want my patients measuring out their food for the rest of their life? No, certainly helping them eyeball, okay, that's about half a cup. Now I should fill the rest of my plate with vegetables. I find that approach can be really, really helpful for understanding portions and portion control.
Yeah, some of those guidelines are helpful. Like when you look at a plate, your protein is like the size of your palm, and then you're having like half of your plate with lots of those like fibrous vegetables and salad and things like that. And then more of a like quarter of your plate, which is probably going to be about half a cup, is kind of more of those complex carbohydrates.
Mm-hmm. So yeah, okay, perfect. Got it. Thank you. Totally. That's what we love to hear. Again, if something comes up that you have questions, you can send us an email, info@higherhealthcenter.com, or you can post in our Facebook group, and we will be posting some sample recipes there later today. So stay tuned and make sure you join us tomorrow for lab testing.
Thursday.
And Thursday, not tomorrow.
Yes,
join
so our
us
final
Thursday for our lab testing.
So our final day, our final day will be Thursday at 12 p.m. noon again. And again, we'll be sending up this recording later. And stay tuned for those recipes.
All right. Take care, everyone. Enjoy the beautiful sunshine.
Okay. Bye.
Bye.